visible.
Yeah.
Good evening, everyone. Welcome to another edition of the 9th edition of TMC Monologues. And today we have a very distinguished alumni from our own college, Dr. Ganesh Kumar Parasuraman. And I invite Dr. Rafiq sir to say and introduce the speaker to our audience, please. Rafiq sir.
Okay. So sorry for all this. I'm very sorry. Dr. Ganesh Kumar Parasuraman MD, he has been, he is now heading the National Institute of Epidemiology in Chennai for NCD, and he was the award winner, the National Gold Awardee, National E-Governance, Government of India Award winner for the World Heart Federation to 2023. So that's one of his key accomplishments. He was on the ICMR side when we were doing India Hypertension Control Initiative program all over India, and we used to look up to him as cardiovascular health officers for technical support. So all the workshops, all the trainings for 4 years nearly, I enjoyed his technical inputs. And on Simple app also, we used to collaborate. The app that was designed by ICMR, then people from Google also helped us from US. So all of us, we had a good time. And, coming back to... Pardon?
Hello, sir. Go ahead.
Pardon? Okay.
Go ahead, sir.
Okay. He has got 2,500 research projects designed, conducted, and reported. So that's one of his key achievements. And, being in ICMR, he's had the privilege of also doing projects like IMNCI in 8 Indian states, evaluation of diabetes and hypertension control program in 3 Indian states, and so on. So during COVID-19 also, a lot of research was done, and emergency responses were conducted. And field epidemiology, you need not say, has monitored 25 FETP scholars and 16 has been graduated. As for his technical skills, field epidemiology, implementation research, data visualization, epidemiological analysis, program management, public health advocacy, informatics and innovations, where we did the Simple app, and then diverse collaborations and resource planning. Presently now, a scientist and head of the National Communicable Disease Division in National Institute of Epidemiology, Chennai. So that's where he is. And what I like best is he's from TMC. So having a national figure in ICMR, is something I hit myself on the head for not using him properly for research purpose in our own alumni. So that is where we are lacking. We should use him before he retires or something. We should use him. So with this small introduction, humbly I introduce Dr. Ganesh Kumar.
Dr. Ganesh, you can go ahead with the talk now.
Thank you, Dr. Venkatesh, and thank you, Dr. Rafiq, for the fantastic introduction. And as he said that I wanted to limit myself as a proud TMCN, and this is my duty. When Dr. Venkatesh asked me that, he has started a TMC Medilogs, I've been really inspired by that kind of an initiative that he has been doing it, and I expressed that I definitely wanted to be part of this. So moving ahead, today I will be discussing on hacks of scientific writing. When it comes to scientific writing, most importantly, it encompasses 3 important things. So number 1 is that the way that what we do as writing research papers, which is manuscripts. Number 2 is that executing scientific communication in a technical audience. And third is that writing to the conference proceedings that you are going to present it to a larger audience. So all these things encompasses as a broadly as scientific writing. But today I will be focusing more on two important things. One is on the manuscript writing, and the other is on the abstract writing. And I will tell, based on that, I've been working in ICMR since 2014, and prior to that, I've been working in medical college. So I published nearly along. I've been privileged to have a very good collaborators and co-authors, and I wanted to thank them here. Uh, Published nearly some 90 papers. So I wanted to bring what actually the most important hack when a scientific writing is considered without disturbing the quality of it. So without wasting much time, I wanted to move ahead. The disclaimer I wanted to mention here, the views and opinions expressed in this presentation are entirely my own and do not represent or reflect the official policy, position, or endorsement of my institute or any affiliated organization. Any errors or omissions are my sole responsibility. So I wanted to tell this key important aspect, which is called the Lancet mantra. Lancet has this mantra. Whenever you wanted to express it to someone, these are the three important questions that you always need to ask. One, which especially on a scientific communication, number one, is it new that you are actually going to communicate? Is it true that what you are going to communicate? Do we really care that this area is actually relevant to the current medical discipline, or is it an important public health problem or a clinical problem? All these questions first you need to ask. Even if you don't, if you have no in any one of this answer, then you need to again go back to the drawing board and try to see what you are going to write. So I would say this is the first checkpoint whenever you think of writing something. When you wanted to do some kind of like a scientific communication on manuscripts, which can be originated from your affiliated academic organization, or it could be say like your hospital healthcare organization, or it could be like from your practice. So whichever it is that the breadth of information, whichever you are observing, and you think that this is something I need to tell to my colleagues, this is something I need to share with my colleagues, which is really going to affect either the clinical care or the patient care or the public health part of it, then we should do that. And it is totally unethical when you know something and you are not sharing something. That's one thing I always say as a basic ethics of a medical doctor. First and foremost, whenever you are going to write a scientific communication, the most important thing always is first you need to choose a right journal. That's the first step. I'll tell you, this is most important hack. Majority of us, what we do is that we write a paper and then we go and find a journal. First step, you need to know what you are going to write. That's what the Lancet mantra. The second step is that like you choose a right journal. That's a key aspect, and you need to know that where you are going to submit it. Okay, how to choose a journal? Why? First is you need to prepare your manuscript right from the beginning based on the journal requirement. Some of the journals will mention that they are limiting only 3,000 words. Sometimes even your own scientific communication material may not be amount to 3,000 words. It may be a shorter information amounting to 1,000 words or 1,500 words. Then you need to definitely check upon what is the journal's requirement and what kind of category that you are going to submit. I will sometime tell in my presentation about what are the different types of scientific manuscripts that you can submit it. The very common is original manuscript based on your primary observation, what you have observed and what you are going to report. This entire presentation will be talking about an original manuscript only. Second, read similar articles in that particular journal and you should know the scope of it. Scope is very, very important. You could have clearly seen that it is there mentioned as aims and scope in any journal website. And there you need to read similar articles in this particular journal and try to see that what they will publish, what they will not publish. Third, journal with more papers of your interest you need to select. How do you identify this? This you can very well identify. Sometimes many of your colleagues will be presenting it, or that topic which you are going to write, you search in the database, in the any kind of a database, which is can be Google Scholar or a PubMed, and try to see where these kind of papers are keep getting published, in which journal it is getting published. That is a journal of your interest that you need to select. Fourth, this is whichever is reputed in your fraternity, that is the low-hanging fruit. Many of your colleagues are your clinical society, your professional society. For example, if you are associated with liver disease, either this Indian Liver Disease Society or INASIL, which is gastroenterology and as well as liver diseases, wherever they are keep publishing it, which particular journal is there, you need to know this. And that is your journal of your interest where you can first submit upon. So now you know that like choosing this particular journal is very, very important. And this journal selection, how you need to do that. Journal publishing your similar work, at least it should be PubMed index and it need to have an impact factor of at least 1. I'm not asking 10, at least 1, impact factor 1. Impact factor is a measurement which tells about of the total number of the denominator is that of the total number of articles whichever has been published in this journal, and the numerator is that number of articles, number of citations of those articles is the impact factor. At least it should 1, which means that of the total number of articles, the number of citations should be more. So make sure that it is there. And how to identify that is you can go and search in PubMed, and there is a section, something called the NCBI database, which I will show you at the end of the presentation, how to search a journal in PubMed. Most important, this is one of my humble requests, and as well as many of my colleagues have become a victim of these predatory journals. They will reach out to you, they will write to your email box and asking that we are so and so journal and we will publish your work, and this is what actually we wanted to publish. You please submit it, and they will tell that like if you pay 5,000 rupees, we will publish it next week also, even next day also, and it will come online in that particular portal. These are all predatory journals. Never ever land up into those predatory journals. That's why I'm saying that it is more a matter of your prestige. If you get published your paper on predatory journals, then definitely in your professional circle, your reputation is at stake. And what your fraternity reads more is the key important thing that you need to always focus upon. Whenever you have selected the journal, you go and read what is the instruction to the authors. You need to spend some amount of time. Please believe me, it does not take more than 10 minutes. Yeah. So just you need to go through that particular journal of the instruction to the authors and try to read that what actually their requirement. Why I am saying this very specifically is by means of like an enthusiasm, you would have completed say like some 4,000, 5,000 words. Please believe me, cutting down 4,000, 5,000 words into 3,000 words is very, very, very difficult. I do know that many of you must be having what's going on in your mind. The current advent of artificial intelligence, generative AI, and large language models, it may be sound to be very easy to write a paper when you're throwing an idea or some data into ChatGPT or Gemini. Believe me that now majority of the journals are equipped with AI detectors. If your paper is written on AI, there is a higher probability that they will reject you and it is not an original work. And also, many journals are now currently asking a disclaimer, the usage of generative AI in the paper, and you need to tell at what level that you have used. There are certain good generative AIs where you can use ethical usage, something like Grammarly check. All those things are all allowed and you can disclose it. So the disclosure of that particular thing, you need to do this. If you don't do that, anyhow, they will pass through the plagiarism check and as well as AI check. which will clearly tell you that it is majority is AI written. And I, being a reviewer of many journals and as well as proposals, and keep seeing that majority of them are AI generated. This is one important matrix with the grid, which I wanted to tell you that what happens when you choose a good quality journal versus true and new useful journal. Your predatory journal, poor quality journal may looks very attractive because they favor you everything, which is something like they will tell you, you just submit, we will publish it as it is. The chances thing, if your paper does not have any good quality, there is nothing new, it is only a redundancy that you have written, and you are submitting to a good quality journal, definitely it will get rejected. Believe me that my first paper was rejected nearly to 6 to 7 times. And each and every other response I have received, I have considered carefully in making the article more and more better. I tuned it, crafted it well, and 6th time only it got accepted. This is the pain and energy that you need to undergo when you are going to publish in a good quality journal. Assume that you don't have a good article and there is nothing new information. It fails in all aspects of Lancet's mantra, and then you submit it in a poor quality journal. Then what happens is that they will publish and they will bury your work and reputation. I have seen many journals suddenly get disappear from the internet, but still it is available in the form in Google Scholar, and people will see that like, okay, this is the kind of a work done by this particular person, and what we have seen is he has published in a predatory journal, and then what they will think is that this is too bad, and your reputation will be at stake. You may have a very good information which you wanted to publish it in a good quality journal. I'm not telling it will get published. I wanted to say it may get reviewed, and that's why I said that it will undergo multiple reviews in order to come out of it. And the fourth thing is that when you are submitting a viewer important work, which is a true, which is new, and as well as a reliable, useful information, and submitting in a poor quality journal, they will definitely publish, but your work is going into a waste and your reputation is at stake. Whenever you are going to write an article or a manuscript, you always should think something called SOCO. SOCO means single overarching communication objective. What is that one-liner message that you wanted to say? In cinema, they say "Kadai karu," which is the same thing I wanted to tell here. The one-liner, what you are trying to tell me for this particular work that you are going to do. That is called that SOCO. We always say this SOCO is an important acronym we use in scientific communication and as well as many other communication. There is a SOCO for you also. There is a SOCO for your hospital. There is a SOCO for every other piece of information. I have presented here one liner of one of the paper here for an example. They mention like this. What is this? A paper which is published in Human Reproductive Open in 2020. They published it like this. We found exclusive use of intragestational sac, potassium chloride, and methotrexate was effective in the management of viable cesarean scare pregnancy. This is that one-liner. And you clearly know this that what kind of the study design and all those things will come in a full article. But one piece of information they wanted to say is that this group of authors have used intragestational sac, potassium chloride, and methotrexate, and they found that it is effective in the management of viable cesarean scare pregnancy. And it is a primary study. That's why they mentioned we found. This is a classical one-liner for that. You may try doing this one-liner and you need to keep writing it. Is there anything you wanted to tell for the exposure or it is an outcome? You will have an understanding about it. Always try to understand the structure of your manuscript. The structure of the manuscript falls under these 4 important headings, which we popularly call as IMRAD. IMRAD stands for Introduction, Methods, Results, and Discussion. So, what actually these sections relate to it? It may sound very easy for you to understand. It may be sounding like a self-explanatory. Introduction means introducing. Methods means some methods that we have used. Results means what is the major tables and figures. And discussion is that
I wanted to tell about what we have done and what it trying to tell about that. But it's not so direct. But what I wanted to say is this like that. Introduction tells or gives you the answer to this question. Why did you conduct this study? That actually encompasses introduction. That is introduction. Second, methods. What did you do? In order to conduct the study, what are the things that you did in to generate that data? And the data part comes in the results. What did you find? What you observed? What actually you have observed in that set of participants or in the set of patients? And finally, discussion section tells what does it all mean to be? What it makes sense. So these are the four important sections, and this is what the question you always need to answer. I strongly suggest maybe in the forthcoming slides, you will also understand that like I will be saying what actually you are supposed to do in these respective sections. You try to draw one liner for each and every of these questions. The same methotrexate, intragestational sac, potassium chloride. For that particular example, why did you conduct this study? This simple answer here is that the evidence of management of cesarean scare pregnancy was weak. So that's why we did an interventional study of the combination cocktail of methotrexate and potassium chloride. Maybe I'm just hallucinating here, but I'm trying to give a hypothetical answer. What did you do? They would have did a randomized control trial of two arms, double-blinded, one with potassium chloride methotrexate and other with conventional treatment. And the outcome here is that like outcomes of the pregnancy. Maybe what did you find? What we found is it is effective, and we found that the effect measure maybe that they have used is an attributable risk that the methotrexate potassium chloride combination has improved the outcomes 4 times compared to say the conventional management. Maybe that's what the finding. And finally, what does it all mean? There you can clearly mention that what does it all mean here is that like with the 4 times increase in terms of effect measure, that it is effective. We wanted to include this into the routine clinical care, and methotrexate, potassium chloride could be considered as an essential standard of care for the treatment of cesarean scare pregnancy. I'm just giving a one-liner, trying to draw a one-liner here. The same thing you can start doing it. This is the best starting point. Literally, this is a pen and paper task. Ask the first 3 questions of Lance and Mantra and try to give an answer. If anything no, don't proceed. Go to the drawing board. Again, try to see what actually you wanted to tell. Then go to the journal, identify it. Third step, you understand the structure. Ask these questions. Try to write in one-liner and the SOCO, which I mentioned in the previous slide. This gives you a very good confidence what you are going to write. And this does not take a lot of time. Majority of the problem in manuscript writing, people land up into, first they will write introduction, forgetting about what they wanted to do next. Always there is a confusion, which is the best writing order. A lot of research has been done on this particular writing order, and it is clearly told that evidence is more closer and as well as logical if you maintain this particular writing order. I would say this as we have adopted this widely for the past 25 years in our institute and as well as in our circle, and we found that this is really working and it saves a huge amount of time. You can maintain this as a kind of a checklist also. Number 1, always starts with a high-level outline. I'll tell what is high-level outline in the next slide. Number 2, start writing methods, because this is something what you did. What did you do? This you have written already in your proposal, or you know what you did in order to generate this data. Write that part. Third, results. What did you find? Because this is immediately you can write from tables and graphs.
Fourth, then only you need to come back to the introduction. Fifth, then you have to write the discussion part of it. Then sixth is you need to write an abstract. And seven is finally your references. Never ever write your abstract in the beginning. Definitely it is going to be a futile task and it is very difficult for you. You may all think that abstract is a sum of the one thing which I wanted to start with as a one-liner, but it is totally different what you have consumed that this is abstract and what I am going to tell as an abstract. Let's start discussing about what is high-level outline. Please feel free if you have any questions, if you have any clarification, you can definitely stop me and also ask your questions. Most welcome. Across all these 7 parts, very, very important, you need to do a thorough literature review. This is what I would suggest that you keep doing it across these 7 steps again and again. Now, currently, there are a lot of fantastic AI-based agents and as well as AI-based softwares, portals, which clearly gives you an immediate solution for doing this literature review. Maybe I would prefer to do this in a separate session. Very interestingly, there is a superb amount of tools are available which are super good and very effective, and they don't hallucinate much also. What is high-level outline? High-level outline is a matrix of the contents of your particular manuscript. Prepare your bullet points on each of these matrix. That's what I would say. Like how to do that. First, plan A is number 1 for introduction section. You write these are the 3 important paragraphs that you have assumed that I'm going to write. And in these 3 paragraphs, you write the contents of this particular bullet. Maybe the overview of the subject matter, what is the existing information, then rational justification and objectives on the 3rd paragraph. You first write bullet points of all these things, and that will help you. I'll also show an example for that. Plan B is that write it like that entirely all together, writing from objective, results, conclusion, and recommendations as a one single line with the bullets. For example, you can clearly see the same cesarean scar pregnancy. In that scenario, the objective was 2 objectives. One is evaluate the role of exclusive local treatment of cesarean scar pregnancy. The second objective is delineate the consecutive reproductive outcomes. For the first objective, they found that 93% reduction in HCG by 14 days and normalized by 54 days after treatment. The conclusion is possibility of treating CSP with exclusive usage of KCL and methotrexate, even in patients with high HCG levels at diagnosis. And delineate reproductive outcomes, these are the one-liners. What the results, bullet points, 4 out of 6 desirous of future consumption, 3 conceived naturally. Conclusion, KCL plus methotrexate, first line minimally invasive treatment option in patients desirous of future fertility. So the overall recommendation is that accumulation of further cases is necessary to validate this treatment modality. Maybe this is a one hypothesis that they want to generate, and that's what they are recommending for all future studies. This is the other way of writing the matrix of contents as a high-level outline. Next, your title. This is very, very important. Maybe I would suggest that title, you need to do it at the last, not at the beginning. But whenever you are coming to the title part of it, always keep using or keep telling about this. Number 1, few read your paper, but thousands read your title. So title is the most important part of it. Title draws attention. Title should be very, very catchy. Each and every word should be carefully selected in a title, and improperly titled will be virtually lost. I'll give you some examples. The very best thing is that I will say keep it short and simple. KISS. Very short, not too short, not too long. I would say that's what, keep it very optimally short. You see, this is a 2 classical examples. Both are published papers. The above one was published in 1896 in Journal of Royal Society of Microscopic Sociology. You can clearly see this. On addition of the methods of microscopic research by a new way of producing color contrast between an object and its background or between definite parts of the object itself. Please believe me, this is a title. This was in 1893. And one more article which is published in 2016 in Diabetes Self-Management, there is this kind of title is also there. Finding the mind-body connection. That's it. We don't know what actually it is trying to tell. For original articles, definitely this is not the titles that we are supposed to adopt it. I'll give you a very classical title at the end of this particular session. And most important thing, avoid waste words in the title. These are waste words in the title. A study of, investigation of, and opening with a, an, or the, and repetitive words. There is too many and in the title. This and is, it's well researched that in terms of like in etymology and as well as in English, what they have identified is and is one thing which make people tired. If you read one and itself, they take a side. And if you come across two ands in one same title or a sentence, that's it. They will be virtually lost and they don't have any intention to read further. Immediately they will skip to the next line. This is what the human tendency and the usability of sentences and. Specific title. I'll give some examples on this. Now here, this title, effect of exercise on PCOS. Now, it is very generic and as well as very vague. We don't know what kind of exercise. We don't know which type of PCOS. We don't know what will have the effect. We don't know who are the participants, which place, when. Nothing is been provided in this particular title. Rather, here, when I am trying to bring little bit more attention, effect of high intensity interval training, this is the exposure of interest. The outcome is on insulin resistance PCOS. This is the outcome of interest. But whereas, and I am giving little bit more information out of it, now you can see is effect of high intensity interval training over homeostatic assessment of insulin resistance among women 18 years and above with insulin-resistant PCOS at St. Olav's Hospital, Norway, 2013, a randomized controlled trial. It may sound to be very lengthy, but I'll tell you, it contains all the necessary information it has. It has an intervention group, it has a comparison group. It also tells about what is the outcome they are going to study. The outcome they are going to study is that homeostatic assessment of insulin resistance, which is HOMO-IR, and the study population is 18 years and above with insulin-resistant PCOS. The study location is St. Olav's Hospital, Norway. The year is 2013, and the study design is a randomized controlled trial. This is a very classical title, which is mandated as per that consort statement where you are going to report clinical trials. Now, let's jump into these four important sections, and I will try to tell you that how you can better write starting from high level outline to each and every section. Now, I'm going to deep dive into each and respective section and try to give a kind of like an overview of this. Basically, it's nothing but arguing your case, what you are trying to infer this, what you are trying to communicate here. Introduction. I would suggest that keep these four boxes as your basic intent when you are going to write an introduction. I'm specifically saying for those who has a difficulty how to start in an introduction part of it, you please take this as a guide. These are four boxes tells about four paragraphs or the four parts of your introduction. The first part is nothing but you need to write what is known about that particular subject and what is unknown about the subject. For example, related to the PCOS, what is known is that majority of the PCOS interventions may be targeted over the objective measurement of the PCOS, but may not be an additional associated condition called HOMO-IR, and that's why I wanted to do. This tells about both known and unknown. Second part, why this issue is important in this region and on a regional level and local level, and support it with the data. That's the part I wanted to tell here in the second part of it. Why it makes sense. Please remember and also recollect. Introduction tells about you are trying to answer the question, why did you conduct this particular study? So All these four parts try to tell you about why did you conduct the study. The third part of the introduction is that rational or justification. Apart from all these things, justifying why you are conducting the study in this particular context and here at this particular place. That's the part we need to always understand. The fourth part of it is that objectives. Objectives always should have a measurable part into it, and that's the ending of an introduction. Some of the journals keep telling about objectives as a study design aspect, also maybe at the part of the methods also. That's why I say choose your journal. The second, let's deep dive about methods. Methods has the four important parts. Basically, try to answer the question, what did you do in this particular study? The part A tells about how you selected your population, which is nothing but encompassing study design, inclusion exclusion criteria, sampling size, sampling technique. Part B is how you collected the data, what are the data collection procedures, what are the tools and what are the standardized tools that you have used in collecting the data, what are the measurement procedure, what are the biochemical measurements, what are the investigations you have did, what is the make of those instruments. All these things comes under part B. Part C is statistical analysis. What is the data analysis? What are the outcomes? What are the statistical tests that you have used? Which statistical software you have used? The last part of the methods, part D, tells about all other aspects of it. What are the human ethics considerations? How the confidentiality of the participants were guarded, were protected, and what are the quality assurance and the registration techniques that you have did? What are all the quality assurance procedures? Are there any clinical trial registration? Are there any approvals that you have obtained for this particular study? All these things, if it is drug trial, any regulatory approval, all those aspects comes in the last part of it. These are the four parts of the methods. Let's deep dive on results. Tables and figures are ready, and then only you are how to write the results. And I would say like the number one dictum, whenever you are going to write a manuscript, first and foremost, your tables and figures should be ready. It can be an half-baked portion, doesn't matter, but it should be in a table and a summarized figure form. And then it is ready, then you need to have an analyze the data and try to transcribe that completely and prepare some slides and try to discuss with someone. This is the table and this is the interpretation. This is the figure, this is the interpretation. This will gives you a kind of confidence that what you are going to do, what you are going to tell. And I would say nearly 70% of the readers of a manuscript are more focused on the results aspect of the section. So they will be reading more and they wanted to take very key information from these results. So it has three parts. Part A describes your study population, which tells about age distribution, gender, and other stratifications. Part B addresses your objectives. What are the key objectives that you wanted to answer and the tables and figures related to? And part C is that additional investigations. Please understand, never ever interpret your data in the result section. Just say what you found. That's it. So there are certain important hacks here. Always put your salient findings in the beginning. There is no data means there is no sentence in results. Every sentence in results should have a data, no assumptions, no personal opinions, no any kind of like an hallucinations here. Do not interpret data in the results section and do not quote your any references. Results part never ever have the entertainment of having the references, and do not spell out every row of table. No need to tell. Don't tell that table 1 tells this, table 2 says this, figure 1 says this, figure 2 said this. No need at all. That is not going to work out at all. And please never ever add any adjectives. Something like surprisingly, we found that very sadly, nearly 20% of the patients had adverse outcomes. No adjectives and never ever use etc. anywhere else in this particular table. Okay, in the result section. Discussion part of it. Discussion is something like winning your case. This is the portion that where you are trying to tell that I want to win this case based on this. Here is the only portion where you can little bit tell about your opinions, very little bit of your opinions in this part. Number one, what you can do, interpret your data. That's the number one. Number two, your points speaks here. Just to tell some of your points. Add those specific outcomes or specific opinions or some part of it. Third, supportive evidence of your point. Supportive evidence is nothing but here what you are trying to tell about, like quoting the references from the other articles, from the other published studies. And finally, take-home message should be there in the discussion. Don't write these things in the results part of it. This is one thing I found as a commonest mistake in the manuscript writing. So I will also say the 3 paragraphs of the discussion. Para 1, summary of your findings. Summarize all your findings. What I found is there. As a summary, no data. Don't put the numbers, don't repeat the numbers again. Para 2, tell your point, what you are trying to interpret from your side. And don't hallucinate here. Don't try to put lot of other things like your own over opinions here. What I could say, that's what in the your point. Part 3, limitations. Here in the limitations, what I cannot say. Most important section which is neglected is committing your limitations. Everyone is so much proud of their work, which is understandable. Don't get so emotional. Be very logical when you are trying to say here, and clearly say what I cannot say and what I could say, what I cannot say, and the limitation section of it. Para 4 tells about conclusion and recommendation, what I conclude and what I suggest. Even if you can see that if you start answering all these questions, whichever I have jolted here, that will clearly give you the first draft of your manuscript. Style is one thing which we need to be very conscious on it. Clarity on usefulness of the study. What you please put yourself on the reader's shoes. Are you trying to give a clarity? Are you formulating key messages in your article or not? Limit unnecessary words and fillers. And use strategic sentence structure. Most important, what I am trying to say here is that give a flow when your reader start reading the manuscript from the introduction till the discussion part of it. For adopting the style, I suggest this 6X. What are the 6S? Keep it simple sentence, short sentence, structured sentence, sequential sentence, strong sentence, and very, very specific sentence. No, nothing vague on that. To be very clear, I try to explain here. Simple sentence is try to explain to a lay person. That way you need to write. Not all the readers, including the journal editors, are an expert of your area of research. You may be introducing certain newer things. If it is nothing sound to be new, then definitely everyone is an expert, and you are not going to produce anything getting into a newer insight of your manuscript or paper in the respective discipline. Short sentence, don't have complex sentence. We always adopt that nothing more than that 15 to 20 words in a specific sentence. Start and end of logic, which is that I said sequential, structured, and sequential is a reader should have on the chain of thoughts. They should go through all the chain of thoughts what you are trying to tell. And verb is the center of gravity. Okay. So the strong side verb, I wanted to give some example here. If the verb is weak, sentence is weak. For example, don't use we assess the prevalence. Rather, you are measuring something, write it as we estimated prevalence. Don't tell we did an interview. Rather, you say we interviewed directly. So, verb is the center of gravity of your most important sentence. Please always use active voice, but I also wanted to tell that there is a disclaimer. Some of the journals keep telling passive voice. I had the personal experience of being writing more active voice on the journal corrected and tell us that please adopt an passive voice into it. So whenever possible, use active voice. Example is clarity of writing is promoted by the use of active voice. Rather, authors who use active voice write more clearly. This is what I say, the difference of a passive and as well as active voice. Active voice takes the responsibility of the author and the investigator group in order to put it forward. Words to avoid any and words to avoid and replacement. Never use probably, please use may. Never use show, instead use indicate. Don't tell prove again. Never ever say we prove that. No, it is wrong. Write indicate. Don't tell we reveal that. Rather, you say you indicate or suggest. And don't say it appears. You spell out what data suggests rather than telling it appears, which is you are at a surprise. Don't do that. And don't use should. Should not use should. In the major problem that I know that there is always an authoritative responsibility for any doctor writing a paper. When they write the patients, they just say that they are dispensable and they are their subjects. Never ever have that idea. And they keep saying pregnant mothers should be counseled. Never ever use this word. Rather, the improvement is use imperative. Counsel pregnant mothers. Improvement 2. Why to do? Counseling will improve breastfeeding. Improvement 3. Include both. Counseling pregnant mothers will improve breastfeeding. You see that pregnant mothers should be counseled for breastfeeding. Rather than that, the third improvement, counseling pregnant mothers will improve breastfeeding. This sounds much better. So how to start? This is one thing I wanted to say this. Start with a high level outline, go to the reference part of it. And always use this 30 for 30 rule. You start small, which means even 1% every day will make a huge compounding effect. Even if you don't do 1% every day, you are going to lose a lot over a period of time. 30 minutes on 300 days is 900 minutes. You are really on 5 to 10% of the whole group of the people who are in your discipline. So with this, I just give you a kind of like a take-home message. The take-home message is this: start from here and end with this. Never ever start with an introduction. Start with a high-level outline and bulleted points. I really thank you, Dr. Venkatesh and Dr. Rafiq, who keep inspiring and actually encouraging me to participate in this Medilogs, and I will keep interacting with all of you. Happy and thank you for this wonderful opportunity.
Thank you, Dr. Ganesh. That was a very wonderful introduction to the coming series. I think, as you rightly pointed, we will have a separate session on literature review and critical appraisal of the papers, and we'll take this as a series. In fact, we are mooting this idea of involving others also in writing more about scientific writing and critical appraisal of papers, which will be of great use to trainee graduates. And so that's one of the points. So if the floor is open for audience to ask questions to Dr. Ganesh Parasuraman. You can unmute yourself and directly post the question to him, or you can put it in the chat box. We can read that out too. Dr. Nivedan, you have made a comment in your chat box. Would you like to speak out? Dr. Nivedan, you're there?
Hello, sir. Is it audible, sir?
Yeah.
It was an excellent session, sir. It's a crispy message that had been delivered. I have seen more new undergraduates being took part in the session. Thank you so much, sir. Just want to convey this thing. We can use this kind of perplexity or concise for reviewing and selecting the journals, and we can also use it for reading it quickly and comparing various literatures. Just want to make the comment, and also it's been available. This pro version been available. Just want to, if sir suggest anything about this, sir, using this kind of AI tools in analyzing this.
I mentioned that like whenever you are using in the manuscript as a full writing, what happens is that journals have AI detectors. So they clearly tell how far that you have used AI in your manuscript. There are chances that it may get rejected more. Whether you can disclose the usage of AI is for, say, language checking or any other, say, like for searching the literature, something like that, you can definitely tell that. Whereas for writing part of it, keep it very, very minimal is what I would suggest. Because they have very strong AI detectors recently in all the journals. Many reputed journals use that.
Yeah, sir, correctly mentioned, sir. This, but this humanized tool is also now coming up. I don't know how much they are able to boycott this screening services, but still, we can use it as assistant, as you mentioned, I think, sir.
Yes,
Okay.
definitely. Thanks for this wonderful comment. The humanized tools have been coming up, but please believe me, watermark is always present in all the AI related. They clearly have a pattern, and they are because all LLMs, either from three major LLMs, one is OpenAI, or they get into this Claude, and another is a Meta, Llama. These are the major, and Grok is one thing. But however, majority of these LLMs have the watermarks. Humanized tools are trying to remove the watermarks as maximum. The best way to use the watermark removal is that you rephrase a sentence because you are only humanizing it. You need
Yes,
to spend the time and you definitely humanize it, and it will surpass.
yes, sir. Okay, sir. It's nice to learn so many things from you. Thank you so much, sir. Thank you, sir.
Thank you, Dr. Nivedan, for your wonderful comments.
Professor Murli, sir, you have some comments? Sir, Murli, sir?
So, Murli sir, you are on mute if you are talking. Sorry.
It was a wonderful session. As expected, Dr. Ganesh Kumar, this is the first time I'm meeting you, but read your papers and you proved why you are in such a position. I hope we'll listen to more of you, because I think this is not one session alone. Maybe we need to have a workshop on this.
I'll be very happy to do that, sir. Actually, I've been keep doing workshops for many institutes and colleges on scientific writing and as well as proposal writing. We did it very recently as a MRU initiative at TMC. I came personally and took that responsibility of doing it for 2 3 days as a proposal writing. Dr. Jagadishan arranged it, and surgery, professor of surgery arranged it. But I wanted to do this at a little large scale with all your support. I'm really happy to do that actually.
A question which is not related to this particular topic today, but once the National Medical Council or UGC, they have made publishing almost mandatory in medical schools also at MBBS level. I think they should be prepared for this rather than plunge into it straight away, so that we improve the quality of publications rather than the quantity, because somehow it has got into the psyche of most of the students that something has to be published, and here comes the we sometimes sacrifice quality and ethics at the altar of expediency. So what is your take on this? Like during our times, we used to have ICMR having regularly the summer vacation research programs for second year onwards MBBS. We used to do that. Even now it is there, but majority of the students are not part of that. So there should be something which is incorporated into the curriculum, so that research methodology becomes, for them, it becomes second nature rather than treating it as some very necessary evil, and it's a burden on them, and somehow they have to finish it. Like, for instance, there have been write-ups about how the MD thesis is now mass produced by ghost writers or through artificial intelligence, thereby diluting the quality of the publication. So what is your take on that? From ICMR, I think you must be definitely having thoughts on this.
Thanks for drawing that particular comment, sir. I totally respect your views. See, sir, like we are moving from coverage to quality. The coverage we have achieved to an extent that opening up a lot of medical schools and making a huge amount of a population, generating a lot of doctors. We have achieved a lot for the past 2 3 decades. Now, what we need to concentrate is that quality. Quality, when I am trying to say here, is that like huge amount of an information is being generated in many clinical encounters and as well as field-based observations. All these things are potentially should be communicated to a larger audience across the globe. Now, this entire whatever we are going to write is going to be accessible to the entire globe, provided that it is of a greater work and of greater need. Nevertheless, to say that like Tamil Nadu, especially being established with a lot of medical schools, have a huge, at least all the government colleges have access to the huge amount of clinical information generated from the patient. The first and number most point which I am seeing lagging is that the data is not collected and recorded in a structured way. We lag a lot in that. Majority of that particular information has been available as tacit. It is not structured actually. That need to be documented first. Second, as you clearly mentioned that the capacity of scientific writing is very, very rare even in nowadays. With the advent of AI, people started using it as a kind of like an what I would say like the dopamine gratitude. Okay, right, I have did something and let me submit it towards that. But that should not be the way to do it. Now already it has become among the medical training, scientific communication has become the major basic intent. I could clearly see, but sorry to say that, like I'm clearly see that when a person from where they got it trained, I could clearly see when they are presenting to a larger audience in a conference. How they are communicating there, I could clearly see. The slide sets when I am seeing itself, I can clearly see that. How some of the slides makes different and stand out, how some of the slides are very poor. When they are communicating it, they are not communicating facts, they are communicating opinions. And why these facts are not recorded well, even though some of the information assume that the facts and data are all good, they are not well communicated, and most importantly they'll just land up in conferences, they don't extend further. I would say it is very unethical. They need to know that scientific communication is the most important ethical way they need to do it. It's basic ethics or basic etiquette of any medical professional. In order to do that should be inculcated from the undergraduate training, and we need to start from the faculty is what I would say. Like faculty need to know this much better. The investments of faculty is going to be long term, and we need to do this over a period of time to make them understand and do that. And that they said it. Why AIMS and PGH Chandigarh set apart from any other thing? Because they keep publishing. All the faculty, their research methods are very strong, and they keep writing and they keep publishing, and that's why it will flourish. But we are still lag. I would say we means TMC has to go a long way, and we need to invest more on the faculty. And apart from whoever the administrators come and go, we as a kind of like a fraternity, whoever is there are there in long term. I'm seeing those people for long term, and we need to invest more on them is what I would suggest actually. I stop here, sir. Like, thanks for inviting that particular comment.
Thank you. Thank you.
So, Dr. Ganesh, so we will have a series. We will
Yes.
plan a series of talks like what we are planning with Dr. Sujata Madam. She'll be delivering a lecture, the second lecture on genetics shortly. She's kind of held up, so probably we'll have that in November. And so subsequent talks with individual titles at your pleasure. When you have time, we can go ahead with this. So I will consider this talk as a preliminary or a prelude to what the things to come. So we will see how it goes from here. So if there are no further questions from the audience, can we wind it up, sir? Okay. Thank you, Dr. Ganesh, and thanks for the wonderful talk. And thank you so much for accepting it immediately despite your busy schedule. So we are so grateful that it was an honor and a privilege to have you here. Thank you. Thank you all.
Definitely, sir. Thank you very much, sir.
Thank you. Enjoyed it.
Yeah.